Type 1 diabetes mellitus. Although it was previously known as juvenile diabetes due to the high diagnosis rates in children, type 1 diabetes is not limited as a childhood disease. It can affect individuals of any age, race, or body type. In healthy individuals, the body breaks down carbohydrates that have been eaten into sugars in the blood, also known as glucose. The body then uses this glucose for energy. Insulin, which is produced by the pancreas, is the hormone that the body uses to move the glucose from the bloodstream into the body cells. In the case of type 1 diabetes, an individual's cells that are responsible for destroying invading cells that can cause infection or illness start attacking and destroying healthy cells in the pancreas that produce insulin. This is considered an autoimmune response, meaning the individual cells are attacking other cells in their body. Depending on the amount of destruction of these cells, the pancreas is either unable to produce insulin at all or is unable to produce sufficient amounts needed to remove the glucose from the bloodstream. The result is an increase in blood sugar levels. Type 1 diabetes makes up 5 to 10% of all cases of diabetes. The risk factors for this type of diabetes are somewhat unknown, but lifestyle and diet are not considered risk factors for type 1. Family history does seem to play a role in increasing the risk. It is also believed that parents can pass certain genes on to their children that can put them at risk. Exposure to certain environmental triggers, such as viruses, can cause those genes to become activated and initiate the autoimmune response against the insulin-producing cells of the pancreas. Treatment with insulin replacement therapy can help individuals with type 1 diabetes live relatively long and healthy lives.